Hello, it's Hannah here from Community Action Network, bringing you a brief overview of a report that's been written recently about the Trusted Voices project. CAN have been involved in Trusted Voices for the last 3 years. It's a project that was started during COVID by Public Health Dorset, who wanted to share messaging with as many people as possible across the county about how to behave, act and keep as safe as possible during the pandemic. Public Health Dorset reached out to Dorset Community Action, and the other was Community Action Network, because they realised their messaging wasn't reaching as many people as they wanted, and perhaps there was some mistrust or misunderstanding about the messages they were sharing. As infrastructure charities, Community Action Network and Dorset Community Action have been able to use our trusted relationships with community groups to share pertinent information with them during COVID-19. So as I've said, the messages that we're sharing are mostly linked with health and wellbeing messages. That's what people want us to tell them about what's available locally. The Trusted Voices champions are community group leaders who work with people with protected characteristics. Those cover lots of different people who, for one reason or another, may have prejudice or may have problems or may have discrimination against them and find it harder to trust or to access really health and wellbeing support. As well as supporting people with protected characteristics, though, Trusted Voices wants to support people who are survivors of sexual abuse, who work with asylum seekers and refugees, and who work with people who are relying on food banks or vulnerably housed or homeless, because we appreciate that they're also underserved, underrepresented, and that they need extra support to get the help they need. Community Action Network's relationships with the Trusted Voices champions has meant that they've been confident and comfortable enough to come forward and ask us for some extra help. There were a couple of groups recently who we've worked with as part of the Trusted Voices project to bring information to communities that they set the agenda, they said what they wanted. One group was the Nigerian community in Dorset, and the other group was Dorset Blind Association. We've worked as a Trusted Voices team with these two groups to find out what their community members wanted information about to do with health and wellbeing. We met the members, we found out what they wanted, and we sourced some trainers and some materials that we could share with them to improve their health and wellbeing. For Dorset Blind Association, all of the workshops that we ran in person had an element of sound and scent and fragrance and touch, because they couldn't rely on using their sight to understand what messages were being shared about stress and relaxation. And those were wonderful events where the people involved felt that they had been really listened to and respected, and their needs were met. And we've had some absolutely wonderful feedback from the groups about the information that was shared, the way it was shared, and we're hoping and looking forward to working with more groups closely to bring those experiences to them as well. The champions come together online and in person and have a real mixture of people in the room, people who might not normally meet during their work, and they're able to support each other, find out what each other do, and the collaborations and connections that have been made have been really powerful. I do hope you've enjoyed hearing some information about the Trusted Voices project. There's loads more to tell you, and I'd love to have a chat with anyone who's interested. I can be easily contacted through email. By the power of technology, there it was, and I would love to chat with you online, in person, to talk about the Trusted Voices project more. So the first thing to do is please get in touch. I can sign you up to receive our emails, our newsletters, and we can take it from there and get you involved in the networking. Really, we're just looking for ways to enable people to access health information in a fair, easy to understand way so that they can make the best decisions they can to live the best life they can, and anything we can do to help with that, we'd be delighted to do so. Thank you for listening.